Most of us are aware October is Breast Cancer Awareness Month. It's an important time of year for us women to check in with our health and learn more about the disease because, according to the American Cancer Society, it affects 1 in 8 women. Joining me now, an expert in the field, breast cancer specialist, Dr. John Williams. Good morning, Dr. Williams. Great to talk to you this morning.
Hi, JJ. Thank you for having me.
Absolutely. Please introduce us to this new educational website you created, Breast Cancer School for Patients.
Absolutely. The Breast Cancer School for Patients is the very first video-based, it's free, it's not for profit, website for anyone that has been diagnosed with breast cancer or is interested in learning more about their breast health and how to find breast cancer when it's early. And it's a resource that no one has created and placed everything you need to know in one site and all in video.
Excellent. And tell me a little bit about your background. You've spent many years helping people face breast cancer. And was that part of why you wanted to create this?
I'm a breast cancer surgeon outside the Washington, D.C. area. And I found when I spoke with family and friends and my patients, they were so empowered when I was able to share with them the concepts that they were concerned about breast cancer. And I realized there's just something missing online to teach you what you need to know. And that's why I decided to write a book, but even better, put it on video and put it online, free for everyone. So that's the Breast Cancer School for Patients.
No, it's really interesting because there is a ton of information online, but you wanted to kind of streamline it and make sure people were getting quality information. This is part of this new growing trend called telemedicine, isn't it? Where people are being able to interact with video and engage websites.
Telemedicine is powerful, especially within the hospital. And in some ways, we're hoping to now spread telemedicine in some small way into your own home. So this is free breast cancer telemedicine where you can engage, not one-on-one, but watch a video and get more information with a breast specialist that's narrowed down and teaching you exactly what you need to know if you're trying to decide when you want to start getting mammograms or whether you're trying to figure out whether you need chemotherapy. God bless you have a breast cancer.
My goodness, yes. So all the way from early detection, and helping people go through treatment. That's excellent. Can we talk statistics for a moment? Is there one age group that experiences higher incidence of breast cancer? I know certainly, they say to start getting screened around 35 or 40, correct?
Correct. And if you're 70, you have a higher chance of getting breast cancer than when you're 30. But if you're 30 and you get a breast cancer, those breast cancers are a little bit more threatening. And obviously, it really stops you in your track in your life if you're young. I think the take-home message is start getting mammograms at 40 and get them every year until the dust settles on the matter whether we start at 45 or 50 or do it every year or every other year. And get 3D mammograms. They're much better and they find tumors when they're tinier and more curable.
Interesting. I hadn't heard the differentiation of a 3D mammogram. Are there different types of mammograms? Because I just sort of go in and let the clinic do whatever they're going to do.
I'm so glad you asked. You can take our video on 3D mammograms. If you search that in YouTube, it'll be the #1 video that comes up.
Oh my.
The key concept is we've had digital mammograms, but over the last 3 to 4 years, 3D mammograms kind of do a little movie of your breast, so to speak. So then we can not only find cancers and abnormalities when they're smaller, but also one of the benefits is that it helps us avoid biopsying something that ultimately proved to be nothing. So it finds cancers more effectively and lessens the chance you're referred for a biopsy that ultimately you never need it.
Yes,
so it's a great advance.
I've heard that's been quite a conversation lately. So, well, thank you. You've just taught me something new. I appreciate that tip.
JJ, thank you for having me. And for more information, go to the Breast Cancer School for Patients at breastcancercourse.org. It's free. Learn everything you need to know. Become your own expert in breast cancer.
All right, thank you so much. For more tips and education, you heard the man, visit breastcancercourse.org. Breast Cancer School for Patients is a proud sponsor of the Morning Blend.